So first up, of course, my favorite thing to do is to give a shout out to our sponsors, of course, because without them we wouldn't be here today. So I thank Bristol Myers Squibb, Ipsen, Nova Nordisk, Bayer, GSK, EFW Radiology, and Alberta Blue Cross. All right, let's go ahead and get started. And I'd like to introduce Dr. Sam Lee, who just sat down, and now I'm going to make you come back up. Dr. Lee graduated MD from Memorial University, Newfoundland, and did residency training at University of Toronto, international medicine and gastroenterology from 1978 to 1983. You like to age yourself.
Really old.
This was followed by a research fellowship in hepatic. See, I mean, you get me on these ones every time. Hemodynamics at INSERM Unit 481 in Clichy, France, Dijon Hospital, 1984 to 87. He was a visiting scholar at Technion University, Haifa, Israel, for 4 months in 1987. Now I was just aging you. Then joined the faculty of the University of Calgary in 1988. He is currently professor of medicine, hepatology, with research interests in cardiovascular complications of cirrhosis and also viral hepatitis. He's published 270 scientific papers. Yeah, that's a lot. Written books, book chapters, and co-edited 2 textbooks. He's won several awards for teaching and research, including the Queen Elizabeth II Golden Jubilee Medal in 2002, Castle CLF Medal, Gold Medal Award in 2021, and has lectured in 40 countries. He's a past president of the Canadian Association of the Study of Liver and the International Ascites Club, and was editor-in-chief of Liver International from 2008 to 13. He's currently a counselor of the International Association for Study of Liver. His main clinical focus now is trying to improve viral hepatitis and liver disease care of the Indigenous people in Western Canada, mainly through telehealth. He's led a successful Hep C Echo telehealth program for Indigenous communities since 2015. His retirement project will be to expand this to include other liver diseases and more sites in Western Canada. And if that is not enough, Dr. Lee's recently agreed to sit on the CLF's Medical Advisory Committee. So thank you for sharing all of your time with us, Dr. Lee.
Thank you, Carol. If I'd have known you were going to read out that whole brief, that brief CV you asked for, I would have told you to just shorten it down. I'm a hepatologist. Anyway, okay. So this is, over the years, repeated questions from patients with liver disease. That it just, the same questions keep popping up over and over again. So I thought, okay, this is a good chance to answer them all, or the top 7, the 7 most frequent questions. So in fact, let's, okay, click this, go to the next slide. I went back to MacBook now, so. Okay, here we go. So there are some disclaimers and warnings. This presentation might contain following mature themes, partial nudity, material that offends some people, graphic depictions of body parts, bad impersonations. It's recommended for mature audiences only. I see there's no kids in the audience. These are my conflict of interest disclosures. So these are actually the top 7 questions, but the questions on alcohol have 3 different little subsection little parts, A, B, and C. So it turns out there's actually 9 questions, sorry. So the three questions that I get repeatedly asked about alcohol. How much drinking? How much alcohol is safe? Is it the only cause of cirrhosis? And what about this thing I've heard, moderate drinking protects the heart? So let's go through those. So, yeah, in other words, we can sort of, alcohol can be regarded as this classic old Clint movie from 1967, The Good, the Bad, and the Ugly. Or I prefer the Italian title, which is Il buono, il brutto, il cattivo. So alcohol's been known about since the dawn of time, because alcohol's fermentation of various substances found in nature, fruits and things, liquids. You leave it around and it ferments, some of them, to produce alcohol. So it's a natural substance, and ancient people figured out very quickly, hey, this stuff, that old jug of apple juice we left outside the cave is now rotted, and it's not so bad, you know, I might drink some, and they figured out, oh, okay, it tastes pretty good, and after a few drinks, I feel much better now. I've worked up enough courage to go hunt down that saber-toothed tiger now. So, this is an ancient Egyptian hieroglyphic from about 3,500 years ago, and it shows that ancient Egyptians were well aware of the dangers of drinking. Can you guys read that? Yeah. So basically, the bottom says, as for thy companions in the swilling of beer, they will say something. What do they say? No one will give thee a hand to get up, and they will get up and say, outside with this drunkard. And Egyptian hieroglyphics are kind of cool, I think. I was just one day when I couldn't sleep, and I had too much time on my hands. I was looking at the slide trying to figure out what symbols meant what. And first of all, there's a lot of bird symbols in Egyptian hieroglyphics, which I think is cool. And the other thing is, I was trying to figure out what the drunkard thing is. There's a whole bunch of symbols in the bottom right corner for drunkard, and I figured eventually it must be that figure lying prone on the ground, and on the left side of that symbol is a pool of puke, I think. Just my interpretation. I'm not going for the chair in Egyptian hieroglyphics or ancient Egyptian. And, I used to give this talk like 35 years ago, and at the time there were still some folks in the audience. Did I do so? Okay. In the audience, older people in the audience could remember this radio show from the 1930s. Sadly, this is now 2024, and anyone who was alive to listen to radio in the 1930s, well, those people are all gone now. Even I wasn't around then, okay? I'm old, but I'm not that old. But this was a very popular radio show. And you can actually go on YouTube and just put in the YouTube thing, the Shadow radio show intro or something like that. And every episode started off with this little blurb where somebody would laugh hysterically, and then the voice would say, "Who knows what evil lurks in the hearts of men? The shadow knows." Well, they actually remade the radio show into a movie in around 1992, 93. I think Alec Baldwin was in it. And I've paraphrased that or changed it a bit to, who knows what evil lurks in the hearts of men? Yeah, the hepatologist knows. I do have a few serious slides, don't worry. Okay, here's my bad news serious slide. And last year, Health Canada revised their guidelines, recommended safe limits for alcohol. And this is bad news, especially if you work in the wine, beer, liquor industry. They must have hated this. They're now recommending, it used to be that there were guidelines previously published in 2011 which allowed much more alcohol. In fact, it said men could have 10 to 15 drinks a week, and women could have 5 to 10 or 5 to 14 or something like that. Now they're saying the new limits, safe limits. First of all, if you don't drink at all, 0 is no risk, okay? If you're gonna have alcohol, 1 drink, and a drink is a bottle of beer, a standard 1.5 ounce shot of whiskey or liquor, and a 5 ounce standard size glass of wine. They all contain about 14 grams of alcohol. And what they're now saying is that 1 to 2 drinks a week for men or women is the safe limit. Now, if you have a little bit more than that, 3 to 6 drinks a week, so not even an average of 1 a day, 3 to 6, that confers a moderate risk. And anything of 7 or more has a higher risk of harms. And that increases linearly as you go up for each additional drink. And what are the harms? There are several deleterious effects of alcohol besides just liver disease. Luckily, the liver is pretty resistant to the effects of alcohol unless you really drink a lot, unless you go way over these limits. But there are other organs that are more susceptible to lower doses. I'll get into that in a minute, but first of all, this question about are there good effects of alcohol? And this is an old slide from almost, what is this now, 25 or so years ago. And this was widely spread actually by the alcohol industry. And what it shows, if you look at the bottom, the very left side, that line going across the top, that horizontal line, people who have 0 drinks, teetotalers, people have no drinks at all, that is their death rate from all causes, not just liver disease, accidents, suicide, everything, cancer, etc. That's a 0 line. And then these are large populations studies. The first one, I believe, came from a big HMO in the US, Kaiser Permanente group of like 130,000 people, and they looked at the death records. So people who had a small amount of average daily amount, between about a half to 1 drink a day, had better survival overall. Those curves go down. You see down below on the x-axis, the number of drinks per day, 0, 1, 2, 3. And if you look, the sweet part of that curve, the lowest part, is somewhere around the half to 1 drink a day. And then they looked at other things, especially deaths from heart attacks and cardiac events. And that showed a very similar, even more striking so-called protective effect of mild 1 drink a day alcohol on the heart. So the spirit industry was just overjoyed. It was like their wildest dreams come true, that scientific research was saying, yeah, it's good for your heart to have 1 drink a day. And in fact, a lot of these studies, they summarized a number of studies back in 25 years ago, and there are a huge number of studies. And the interesting thing was almost all of them were funded by the alcohol industry. So, and one wonders if there were actually studies that they funded that showed a negative effect or showed a harmful effect. Did they get published? Probably not. The funders probably said, oh, we don't like these results. We're taking away your funding. Sorry, bye. See you in the next life. So, yeah, many of these studies have now been, they're not retracted, but they've been somewhat discredited because of the bias. But on the other hand, there are potential benefits of moderate drinking. Alcohol, especially wine, red wine in particular, contains literally hundreds, if not thousands, of different substances. And some of them, these are some of them, they have free radical scavenging or antioxidant properties. And in fact, there's good evidence, which I will show you, that moderate alcohol drinking, especially wine, can increase your HDL cholesterol, which is the good cholesterol. That's the cholesterol that helps carry plaque out of or prevent plaque from being deposited in your arteries. And it also decreases the triglycerides, which are bad. So there's theoretical reasons to think alcohol could protect the heart. But a lot of that's old research. Here's the most up-to-date research done by the Scandinavian group. They collected all the world literature up to 2020. And what this shows is that if you look at the top, so this vertical line in the middle is 0, means no effect. If you're on the left side of that bar, it means the alcohol has a lesser, or it drives it into the negative range. It lowers the thing. Whereas if you're on the right side of that vertical bar, the alcohol drives it into, it makes that thing go higher. So the first two items are systolic and diastolic blood pressure. Alcohol appears to, or it definitely increases your blood pressure. And that's been well known for 100 years. Even moderate drinking increases your blood pressure, okay? And then the other thing that they showed here quite clearly, HDL cholesterol, that's the good cholesterol. You want more of that. Alcohol increases that. That's a definite effect. On the other hand, the bottom variable down below, triglycerides, alcohol decreases that. That's also a definite effect. So, and what's the second last, the fourth item is, low bad cholesterol, that has no effect. LDL cholesterol has no discernible effect on that, okay? So this is the result of all the world literature up to then. So far it's looking good for alcohol. And so the bottom line question is, answer is, does it protect the heart? And the sad truth, at least for the alcohol industry, is probably not. And this same analysis now looked at a whole bunch of events, cardiovascular events. Holy cow, it sucks to get old, because now I got to put reading glasses on this slide. Okay, so you can just ignore it for each of these variables. Can you guys see that in the back? Stroke, etc. So there's two little squiggly lines, and the black square in the middle is what you should look at. But for each of those two variables, one is the univariate analysis with just the alcohol. But the second one is most important. That's with a correction factor, taking out the complicating effect of smoking, because there's a strong correlation between alcohol intake and smoking, that a lot of people who drink moderately smoke, or they smoke while they're drinking, etc. So if you remove the complicating effect of the smoking, that's what the second little bar or line is. So that's the important one. And you can see here that at the top, there's a definite increased risk of stroke in drinkers. And the coronary artery, the cardioprotection is actually not significant. those error lines cross the vertical. If you don't eliminate the effect of smoking, it's actually increased. There's a higher risk of heart attacks in drinkers, but if you take away the complicating effects of smoking, there's no increased risk. And the others do not have shown any differences except for peripheral arterial disease that's getting vascular disease in your leg arteries and so forth. Those are increased in drinkers. And the bottom one is aortic aneurysms. Aneurysms of the big main blood vessel comes off the heart. So the bottom line, after all this exhaustive analysis of the entire world literature, the answer is no. Alcohol doesn't protect the heart. I'm probably going way over time. So why did Health Canada come up with these new revised guidelines that are so low? It's because there are, besides the liver, which I've said is fairly resistant to alcohol, you need to drink quite a bit to mess up your liver. You need to go, the cirrhosis threshold dose is just astronomically high compared to what Health Canada is now recommending. But alcohol has deleterious effects on different parts of the body at much lower doses. For example, those low, moderate, high risks that Health Canada just put out, even at what we used to consider a very mild, moderate amount of alcohol, an average of 1 drink a day, 7 drinks a week, there's a discernible increased risk of many different cancers, including especially breast cancer. So that's why they put in these in men. The cancer risks at every site were generally a bit higher in women. In men, the accident risk was dramatically higher, even with moderate alcohol. If men said, yeah, I average, 6 drinks a week or 8 drinks a week, their accident rates were much, much higher than teetotalers or people who had no alcohol. And of course, there's the issue, especially for women, of non-consensual sex. That's the old thing where if you're not careful, you're female, you drink too much, you get tipsy, you pass out. Next morning, you wake up naked in the Hells Angels clubhouse and you go, how the hell did I get here? Why are all these bikers standing around? So they're very clear risks of alcohol, and lower doses, pancreatic disease, chronic pancreatitis. You don't need huge doses to give you that. And I've talked about hypertension and heart disease and strokes. There's a definite increased risk of strokes, as well as what's called peripheral neuropathy and so-called brain rot. People who drink a little bit moderately, if you do CT or MRI scans on them at age 60 or 70, their brains shrink. So it's, bottom line is, sadly, there's more harm than good with alcohol. Now, don't get me wrong. I like to have the occasional drink myself, and I'm not, if you have an occasional drink, it's not gonna, the risk of harms is not massive. So this is, before this cirrhosis threshold dose is 80 grams a day for men. That's the dose at which you have some risk of cirrhosis, and the higher you go, the more your risk. But lower than that, you won't get cirrhosis due to alcohol. And 80 grams is a lot. It's about 5 or 6 beers, 5 or 6 drinks a day. What is that? 42 a week. Way, way, way higher than these moderate doses for men, and exactly half of that for women, because women, for a variety of reasons, are much more susceptible to alcohol than men. So finally, to drink or not to drink, that's the question. First of all, if you're a teetotaler, if you don't drink at all, don't take it up, okay? Save yourself a lot of time and money and aggravation. The literature clearly shows that this old data where teetotalers looked like they had higher death rates than people drank like 4 drinks a week. That's probably flawed data, okay? So don't start drinking if you don't drink. If you have 1 or 2 an average per week, probably safe. I mean, that's where that's the range I'm in, and I, like to have an occasional beer, glass of wine. And I don't think there's any risk at all in that. 3 to 8 per week, there's a moderate risk, and you want to balance that. I mean, okay, before you go crazy saying, okay, the risk of, say, something like stomach cancer increased by 50% with moderate alcohol. But if you put that in perspective, because 50% sounds huge, but if your risk of getting stomach cancer was only 1 in 1,000, and or let's say it's something really low, like 2 in 1,000, and it increases to 3 in 1,000, which is still very, very low, that's a 50% increase. Going from 2 to 3 per 1,000 is a 50% increase. So, these risks are there, but they're still moderate. So, I think once you start going over more than a drink a day, 8 or more, then you're starting to get into higher risks. And you should probably think about cutting back to some lower amount. And as I've said, more than 14 drinks a week is probably you're starting to get some cirrhosis risk. And even though I just said the cirrhosis threshold dose is way higher, that's because people lie about alcohol. I mean, it's just human nature. If you ask people, how much do you drink? And they tend to vastly underestimate by at least 50% the amount they drink, especially if they're problem drinkers. Okay, and what's the big fuss about cirrhosis? Cirrhosis basically, it means dense scarring of the liver. It comes from this Greek word kyros. Okay? And it's always our dark side. Who hasn't heard my Darth Vader? I know about half of you have, probably more of you. You want to hear it? Sure you do, because that's why I'm here. So cirrhosis is, oh, holy cow, Mike doesn't like that.
Luke, feel the power of the dark side.
Thank you. See, I warned you there'd be bad impersonations. So what are the common causes of cirrhosis? And this blends into our next question, which is good, because I'm running short of time already. So alcohol's not the only cause of cirrhosis, even though a lot of people think the word synonymous, the word cirrhosis is somehow synonymous with alcohol. There are 50 causes, or more than 50 causes. Any chronic liver condition will eventually end up with dense scarring if left unchecked, untreated. And the common causes are viral hepatitis, like hepatitis C and hepatitis B. Alcohol, of course, is still a common cause. Probably the commonest cause now is fatty liver, which I'll get into next. And there are other conditions, less common, but inherited, such as iron overload, which is found in Caucasians of European descent. That's called hemochromatosis. And there are autoimmune or primary biliary cholangitis, which can cause cirrhosis. So those are just a listing of probably the most common causes. And this is on the left side is a normal sort of microscopic 10-power scan of the liver, and on the right is a cirrhotic liver, and you can scar tissue or collagen stains as blue, and liver cells stain as red-purple. So you can see a lot of scar tissue nodules in that liver on the right. And cirrhosis leads to a host of complications, including things, fluid accumulation in the belly, gynecomastia in men, that's breast enlargement, loss of hair, decreased sexual function. And on the right, you can, and this is an endoscopy looking down into the swallowing tube, and you can see these big columns of things that look like big varicose veins. And they're going all the way, start about the middle of the esophagus, the swallowing tube, and go all the way down. When some of them get this thick, that obviously they're blood vessels. When they rupture, you can exsanguinate, and that is a common cause of death in advanced cirrhosis. So, second question I get asked, some variant of this: why do I have cirrhosis? I never drank, or I've had like 6 drinks my whole life. And it's because fatty liver, as I mentioned, is now probably the commonest cause certainly it is worldwide, and it's approaching that in Canada and USA. Almost a quarter of the Canadian population has fatty liver. Did you guys get a talk on fatty liver this morning? Yes? Okay, good. Okay, I'll skip all this then. You know all about it. So, this is showing a risk factor for fatty liver. This is an actual website I found, I don't know, it's probably taken down now, but some insane 134-pound white guy, this Joshua Davis, wanted to be a sumo wrestler, and predictably lost every bout, because anyone know how the rules of sumo wrestling? You're in this little sand pit square that's like 15 or 18 feet, got a rope around it, and all you got to do to win is to push your opponent out of the pit. And obviously, the more you weigh, the easier it is, or you can just like grab the guy and throw him out. There's no way some insane 134-pound guy is going to beat a 360-pound sumo wrestler. So anyway, you've got to, I think the other lesson to learn from this, you've got to tailor your hopes and ambitions to physical reality. I wanted to be a 7'3" black man and play center for the New York Knicks, but I never dreamed of that. And let's get realistic here. Okay, next question. Must I avoid Tylenol? And these are all questions that I have liver disease. Must I avoid Tylenol? And the answer is no. Tylenol or acetaminophen, and there's several brand names of acetaminophen. Tylenol is the commonest. It's the safest painkiller in people with liver disease, as long as you don't take big doses. So take less than 2.5 grams a day, which works out to about 8 regular strength or 5 extra strength Tylenols per 24 hours. So if you take any amount less than that, even if you've got bad cirrhosis, it's still the safest there is. And part of the reason for that is people with cirrhosis should not take other common types of painkillers, like what we call NSAIDs. NSAID stands for non-steroidal anti-inflammatory drug. And this class of drugs is the aspirin-like compound. So aspirin itself, or Motrin, ibuprofen, Voltaren, all of those things, if you take moderate or big doses, especially for longer periods of time, and you've got cirrhosis, it can squeeze the kidneys. Your kidneys can in fact shut down. So those are to be avoided. take Tylenol or acetaminophen instead if you got a headache or some kind of pain. Next question, should I avoid most prescription drugs? And the answer is no. Liver drug metabolism is normal unless you've got very far advanced end-stage cirrhosis. And yes, the liver metabolizes most drugs, but it retains its drug metabolizing capacity until it's nearly dead. And by then, if you've reached that stage of nearly dead from cirrhosis, you've got way more important things to worry about. So almost all patients, as I've said, can safely take almost any prescribed drug. Now, even though the warning labels, you look in the textbooks and every single one of them for a different drug says, may cause liver disease, or do not, or use with caution if you have liver disease. That's just for medical legal, that's what we call CYA, cover your ass protection. So just don't worry about it. And the other important feature is that the presence of a pre-existing liver disease, let's say a fatty liver or hepatitis B or something, does that increase your risk of what we call liver drug reaction? And the answer is no, it doesn't. So take any drug you want, a prescribed drug. Okay, next question. And this, a variation of this is probably close on number 1 or 2, in fact. But will certain diets help my liver? Or what diet can I go on to help my liver, or something to that effect? But the simple answer is to this question, does a certain diet help my liver? And the diet that I'm most asked about is the so-called Mediterranean diet. Does that help the liver? The sad answer is no, it doesn't. It's not that it's bad for you necessarily, but it doesn't help your liver. And the liver actually is a heartily resistant organ, and it can protect itself. So what you feed it doesn't really help to any great extent. On the other hand, extreme diets of various sorts, especially too many calories, can hurt the liver. I'm talking about fatty liver. So liver is basically unaffected by normal or minor variations in diet. No diet improves the liver. Extreme diets, as I've mentioned, can worsen the liver. And if you've got moderate or severe cirrhosis, then you have to go on a special diet, low salt diet and mild to moderate protein. But low salt is especially important because all that salt ends up either in your feet or your belly if you have cirrhosis. And yeah, as I mentioned, obesity, overeating leads to fatty liver. And in conclusion, you should just eat a healthy, balanced diet. I recommend high fiber because that's better for your gut and your body in a lot of different ways. And this is a healthy versus, this is the unhealthy diet, and this is the healthy diet. I had to put that stop sign in there. You know, I used to show one of my favorite photos. This is a 25-year photo of Sofia Vergara, the TV film actress, when she was a bikini model or something. That's how she started her career. And I was at a meeting once, like, I don't know, 10 years ago somewhere. Actually, I think it was in Latin America, and she's from Latin America. She's from Colombia, I believe. And anyway, one of the women came up to me afterwards and said, why are you showing pictures of half-naked women? You know, what about some half-naked men? You know, equalness. Okay, so I gave her that photo on the left. There's Anyway, yeah, I have to be careful because in case someone complains Dr. Lee was showing, you know, gender-biased bikini shots and stuff. Okay, which alternative or herbal therapies help the liver? And the short answer is none. Sorry, I get this a lot, especially about milk thistle, but there is no proven, if it was that simple, I wouldn't have a job, and none of the other hepatologists would either, if it was that simple to treat liver disease by an inexpensive herbal or alternative remedy. But in fact, there's no proven benefit. And in fact, it's uncommon, but a few can hurt the liver. So there are various things that have been proposed for alternative remedies, and none of them have, they're so-called liver cleanses or liver cleansers. There's milk thistle. There are drugs that supposedly boost your immune system, like ginkgo biloba. There's gallbladder or bile cleansers. And there are drugs, or not drugs, remedies of different sorts, or herbal remedies that supposedly help regenerate the liver. And as I've said, none of these claims have stood the test, the rigorous test of being proven in a scientific trial. So the good news is most are harmless, but they all cost money. A few are toxic, very few, and not always, but you get a rare toxic reaction to a few of them. None are proven, as I've said. And, I caution you, don't believe everything you see on the internet or hear from a friend. Oh, yeah, I had a friend that had whatever Hep C and they cured themselves with, drinking monkey poo or something. So remember, be cynical. There's a sucker born every moment. Don't be one of them, okay? And the milk thistle has been known since the Middle Ages as the liver herb. So the active ingredient is this thing called silymarin. And the good news is it's safe. It doesn't hurt the liver. It doesn't cause any bad reaction. It does have a weak antioxidant effect, and in several clinical trials, it actually lowers some of the liver enzymes a modest amount. So, okay, it is. But the trouble is, in terms of any real effect, does it decrease the amount of scar tissue in the liver? No. Does it decrease any viruses like Hep B or Hep C? No. Does it boost your immune system? No. But at least it's harmless. Okay, so if people are on milk thistle or some milk thistle-like compound, I have no objection. But you got to ask yourself, if some substance or drug is not doing anything, why are you throwing good money? Why are you paying $30 a month or whatever, or even $15 a month, $10 a month? In a year, $10 a month is $120. You could probably use that to whatever, send flowers to your hepatologist or something. And there's also a myth that if it's found in nature, it must be harmless. So herbal stuff, herbalists like to propagate this myth that stuff that's in nature is not harmful. No, the truth is stuff that's in nature can kill you really, really quickly. So here's a seal playing with, who knows what that thing it's carrying in its mouth is? Yeah, pufferfish. Pufferfish, there has a gland inside that secretes this toxin called tetrodotoxin. You know what tetrodotoxin does? If you ingest even a tiny, tiny trace amount, a few parts per million, it actually causes you to die in the most gruesome way. Curare does the same thing, by the way. That's why the South American indigenous people figured out that they made blow guns with darts tipped with curare, which they got from a plant, and they hunt with it, and so blow a dart into some poor monkey or animal, whatever that they were after. And both of these substances, tetrodotoxin and curare, depolarize nerve endings, which is the medical term. But what it does in effect is it paralyzes your muscles, your voluntary muscles. So you die in the most gruesome way. Your brain still works fine, but all of a sudden you realize you're paralyzed, and oh shit, that means I can't breathe. That means I'm going to die this slow death over the next 3 or 4 or 5 minutes, not being able to move muscle, not being able to breathe, and then I'm going to slowly die, and there's nothing I can do about it. That's what happens. So yeah, nature has some of the most nasty poisons and toxins there are out there. And yeah, every year in Japan, apparently, or no, I've read now that it's improved a bit. It used to be 40 years ago, there was a puffer fish, because Japanese like to eat puffer fish sushi. Don't ask me why. It's some kind of strange death wish or something. But puffer fish sushi, unless the sushi chef carefully removes the glands that make the toxin and remove it, it inadequately made sushi from puffer fish every 30 or 40 years ago, it was caused 1 death a year in Japan. And now it's improved. Now apparently it's only 1 death every 2 or 3 years. So, chefs have learned, but there's still a death once in a while. My question is, if there's even 1 death every century, why are people eating that stuff? Eat sushi, salmon or tuna or eel or whatever. Don't fool around with lingering death. Now that said, I have to confess, on a visit to Japan, I actually ate pufferfish sushi once. Because it was like, it is ridiculously, I was the big invited visiting professor, and there was a whole group of people from the university that, I don't know, there was like 12 or 15 of us, and a couple of the junior faculty were all excited and say, well, we're going to this fancy sushi restaurant because we heard you like sushi. And I said, yes, I love sushi. He said, yes, we're going to eat pufferfish, fugu, it's called. We're going to eat fugu. And I said, what? And so then I remember reading that there's a death every couple of years from this. And I thought, okay, I mean, realistically, what are the probabilities? Come on, there's 130 million, 135 million people in Japan. 1 death every 2 years. That means there's like 1 chance in 270 million that death is going to be me. So they were all excited because one guy told me they'd never be able to afford it themselves, but since the university was paying, they all got to eat it. And apparently the big lure of eating pufferfish is that you get a tiny, tiny bit of the effect. So what happens, and it happened to me, that you get this little bit of tingling around your lips, around your mouth. Just a tiny bit of tingling that lasts for a few minutes. And you're thinking, uh-oh, it started. And then you think, okay, now it's going to spread to the rest of me and I'll be paralyzed and die this horrible death. Luckily, it didn't happen. And this is some kind of remedy that one of my patients gave me 30 or 32 years ago. He was from the Maritimes, from Nova Scotia. He said, this is a stuff, their equivalent of cod liver oil, or this stuff that was supposed to cure all disease, including liver disease. And it was the front of the bottle is called Double QQ brand, and this is the back of the bottle. And if you can see this list of ingredients in the left side column, this oil's got lead mercury, it's got DDT,
Oh my.
it's got PCB, it's got all this toxic stuff and, fairly high concentrations too, not just a few parts per million. They got parts per 1,000 in there. And I thought, holy cow, I mean, you can't be, eating this stuff or drinking this stuff and you're taking a risk. Anyway, that brings us a little over time to our last question, which I get asked frequently, especially online. Where can I get reliable info about the liver? Well, the answer is obvious, CLF. So the CLF website, liver.ca, has a number of good vetted resource materials, because they don't just like, someone's got a great idea, said, okay, let's treat Hep C with pufferfish or something. It's all vetted by experts, their material. And I will say that Wikipedia is very reliable and it's accurate. The only problem with Wiki is that a lot of the material there is written in a fairly complex, you actually have to understand the field a little bit. Like some layperson cannot just read a Wiki article about different medical conditions and understand all of it, because it's written almost at the level of a medical professional. So, but that said, the material that you'll read on Wiki is very accurate. Now I put Google in lowercase because Google does this nasty thing where they accept ads. So if you pay money, you can put up a thing saying, yes, I cured my liver disease with ground up bat dung. So you have to be careful what you read on Google, but liver.ca and Wiki would be the places to get online info. Okay, that's it. I guess I'll take questions later. Thank you.